All right, everyone, we have come to the final panel discussion of the day. It has been an incredible main stage this year at the big health event, Shreveport. We have had doctors from Oxnard, LSU Health. We've had leaders in the Shreveport community, and of course we've had experts from the Urban League of Louisiana all on this stage to talk about all kinds of information related to health and wellness. And I think we are wrapping up in a great way with a great topic. We are here today talking to Tamika Moore, who is a legislative policy assistant to Representative Joy Walters here in Shreveport. Hi, Tamika.
How are you doing today?
I'm doing great. This has been an incredible health and wellness experience, and the topic that we're going to talk about to wrap up this main stage is one that you know a lot about, you and Representative Walters, as well as other members of the Louisiana Legislative Black Caucus. I want to say Representative Walters was with us on Thursday when we had the big press conference here to formally announce the big health event Shreveport. And of course, we've been here since a little bit before 10 a.m. and all throughout the day we've had hundreds and hundreds of Shreveport residents come to the convention center to get information like this so that they can take the steps that are necessary to advance their health and wellness and that of their family. And so let's start to talk about the Uterine Fibroids Commission. That's what we want to talk about. It was created this legislative session, correct?
Yes.
Tell us a little bit about what the commission is all about and where did the thought and the idea come from to create this commission, which I think is going to be a very, very important commission to women and for their health.
Thank you. I'd like to say on behalf of Representative Joy Walters, thank you for having us and thank you for being here in Shreveport for this event to give us that education and that knowledge on our health. The core goals was to create a dedicated platform for addressing women's productive health and challengers and developing strategies to support effective individuals as far as women of color and those marginalized communities that don't really see the the health and the information that they do need in order to make their lives a little better.
And I think it's so important, you know, again, as I said in the last conversation, when I think about the work that our organization does across the state. The Urban League of Louisiana focuses on workforce development. We help job seekers get connected to jobs and find careers. We also focus on entrepreneurship, and so we help small business owners to start businesses and to grow those businesses so that they can pass on generational wealth. We focus on education and youth development. We work with preschoolers and also high school students. So we help at both ends of the spectrum to make sure that they are moving forward, our students are. And we also, of course, are in the health equity space.
Yes.
And that is what the big health event is all about. And so when we really think about health equity, we have to think about gaps, we have to think about disparities. Can you talk a little bit about what you learned and the representative learned as you were putting the legislation together to create this commission? What are some of the disparities and the gaps that we're looking to address?
You have the age gap, you have the gap of wealth, you have the gap of just the knowledge of information about what's being put out there and then access to it. Social economics, where some people are not able to get the information that they need. So those were some of the gaps. And just the information of how fibroids and those other conditions, PCOS and endometriosis, affect so many women and how many women are affected of color.
And I think that's one thing that a lot of people may not really fully understand. You know, you may know about it if it was your personal situation or that of a family member or a friend, but it seems like it is a pretty pervasive issue, that it actually impacts a large number of women. And I assume that that's one of the reasons why
yes, ma'am.
The representative thought that this commission was so important.
Yes, 80% of women by the age of 50 will have some type of issue with fibroids. Of that 80%, 70% are black women. So it affects us more than it affects the other populations. So with that information, there is a need to also, with the research and looking into how we can maybe change lifestyles or what we can do in order to help ourselves with those, since we are the ones that are affected the most.
And when we think about the commission, we have to think about the makeup of the commission.
Yes, ma'am.
Can you tell us about some of the areas that are represented? What expertise is on this commission so that we believe and know that it will be successful?
This commission is made up of 13 members. Of the 13 members, 2 members are actual women that have one of the 3 conditions of endometriosis, PCOS, or they have fibroids. I'm just going to give you a list of who's all on the commission. We have 1 member of the commission from the Louisiana State Nurses Association. We have a member from the Louisiana Primary Care Association, 1 member from Christus Health System, a member of the Southern University and Agricultural and Mechanical College School of Nursing, a member from Tulane University's Public Health. We have a member from Our Lady of the Lake Health System, Louisiana Hospital Association, Louisiana House of Representatives, Louisiana State Senate. 1 member who is an executive director from the Governor's Office on Women's Policy and Oshner Health System, and a member from the Women's Hospital of Baton Rouge. So between the educational background, the organizations, and also having those 2 women that are on the board, they can give us firsthand accounts on how that type of condition has affected them throughout their life.
It sounds like a really, really smart makeup of commission members. The lived experiences of women who are experiencing the issue, so critically important, and I'm really happy to hear that they actually have seats at the table.
Yes, ma'am.
So that they are helping to inform the decisions that come out of the commission. The other thing I want to touch on really quickly is there's a mix of the policy, there's also the mix of programming and direct service delivery. And it seems like this commission is going to be covering all of that. Why is it so important to you and to the representative to make sure that you're not just looking at just one piece of this issue, you're looking at the policy piece, the programming piece, the advocacy piece? What are you hoping to gain by putting all of those pieces together?
What we're looking for right now is to evaluate the existing groups and to serve advisory body to the Governor of Louisiana Department of Health, researching state regulations and policies to relate to prevent and treatment, research and making recommendations to improve public health. So what we're trying to do basically is things that we can do on the state level that will be able to help all women throughout the state and for them to take that back to their communities.
I think that is really, really important. It sounds like this commission is a model that can be used, and I'm hoping that in future legislative sessions, we'll see more commissions like this that are specifically designed to deal with particular issues, whether it's relative to women's health or men's health, to communities of color. We know that when there's a tunnel vision focus placed on a particular issue, that's when things get done. And for us in Louisiana, a lot of the work does begin with the creation of commissions or the creation of laws to make that happen and to advance that work. So I just want to tell you how much we thank you for being with us today. Thank you for putting a spotlight on this particular issue. The data certainly speaks to why it is important, and the work now follows. And
yes, ma'am.
We thank you so much for that.
Thank you again for having us.
Great to be here with you. Are there any questions? Anyone have any questions? Hearing none, then it is my absolute honor and pleasure to close out the main stage here at the big health event in the great city of Shreveport. Again, we hope that you'll go to the Urban League of Louisiana's YouTube page. You'll be able to see all of the conversations that we've had today in total. And I know that if you are watching them for the first time, you're going to learn so much. If you're watching them again, you're going to be reminded of the great, great experts, the important conversations that we've had here at the Shreveport Convention Center as a part of the big health event Shreveport. So thank you so much for being with us, and we look forward to seeing you at the next big health event. You've got to stay tuned to the Urban League of Louisiana to see where it's going to be next, but it is coming to a community and to a great city in Louisiana in the very near future. Thank you so much.